Hello, everyone. If you are new here, if you are joining the family now, this is Time with Nurse Joycelyn. This channel seeks to talk about nursing, everything that concerns nursing, and also offer health tips. If you haven't subscribed yet, kindly do so for me. Like and share my videos. Hit on your notification bell so that whenever I post new videos, you'll be updated. Thank you so much. So, the last time we talked about bacterial vaginosis, we did the part one of it. We learned about what we do before getting them, what we have to do when we have them, um, how to prevent them, and how to stop them from recurring. Today, being the part two of it, we would like to delve deep into what to do and what not to do. I mean, the do's and don'ts when it comes to bacterial vaginosis. So, we are starting with the don't aspect of it all. Last time I talked about douching, and I said the word douche or to douche, actually means to soak or wash. So, in order not to get BV, bacterial vaginosis, or in order to avoid it, you don't have to douche. You don't have to go in there, soak there, or wash there with certain perfumes or soaps. You try to avoid scented products and soaps when it comes to the vagina because it will disrupt the normal action of the normal flora there, the natural flora and the pH levels there. Number two, you have to do away with sharing of undies. As a lady, you don't share your underwears with even your sister, your own sister. You don't encourage that you share undies with others. Yes. Also, you don't have to wear tight clothing. We don't encourage the wearing of tight clothing as they trap heat. They tend to trap heat and encourage the growth of bacteria there. Yeah, they encourage the growth of bacteria there, thereby causing bacterial vaginosis. So we don't encourage the wearing of tight clothing. Yes. Number four, when you have BV, when you have bacterial vaginosis, I know it's quite disturbing and some of us shy talking about them, but the main problem here is that the more you shy and not talk about them, the more you delay the symptoms, the more the complications will come, or the more you near the complications of it all. So, number four on my list, you don't have to delay in seeking healthcare providers' advice. You don't have to ignore the symptoms, be aware of them, and then seek medical intervention appropriately. Number five, you don't have to self medicate. You know, most of us are fond of doing this. Well, my friend got this condition. She went to the pharmacy shop, she was offered these medications, and she got sorted. So I'm also having the same symptoms and I'll go buy those medications as advised by my friend. You don't have to do that. You don't have to do that. Whenever you have this vaginal odor and you think it's kind of worrying you, um it's not something that is pleasant, something that you can do with. What you have to do is to run to us, healthcare providers, seek our intervention and we'll help you accordingly. Please and please do not self medicate. You don't have to also engage in unprotected sex because it increases the risk of you getting it. Even though it's not an STI, you don't have to engage in unprotected sex as it predisposes you to getting an STI. Yes. So we also don't encourage the use of sprays and deodorants around the area. I've said it earlier. Then you quit smoking. You don't have to smoke. Please, if you smoke, you do well to quit it. try. It's not easy, but you try to quit it, because you quit that habit, because smoking actually weakens the immune system, making it vulnerable for infections to invade. So please quit smoking. We don't encourage smoking, as it makes the immune system vulnerable. It weakens the immune system. And if the immune system is weakened, everything can just catch it. The main soldiers of the body is weakened. What else can't happen to the body? It becomes vulnerable. So please quit smoking. Then, lastly, you don't have to feel embarrassed when you have BV. BV is actually curable, it's treatable, it can be managed. So you don't have to feel embarrassed when you have it. Now, let's move on to the do's aspect of bacterial vaginosis. Do's number one. Number one on the do's in bacterial vaginosis is that you practice good hygiene. How do you do this? You wash your hands, wash the hands properly under running water with soap and water before touching the genital area. The genital area is actually the vaginal area. So when you want to touch there, or even if you are with your partner and he wants to go there with the hands, please kindly advise your partner to wash the hands before touching the area, because just maybe the hands may not be clean and will go and disrupt the action of the bacteria there, the normal flora there, and the pH as well. So you practice good hygiene when it comes to touching the vaginal area, that is the genital area. Do's number two, you try as much as possible to um, adopt the habit of wearing cotton underwears. Yes, you wear cotton underwears or perforated ones that will help trap moisture, or that will prevent moisture buildup in the area. Number three, you have to eat well. You eat balanced diets. Also, encourage the eating of fruits and vegetables and yogurt. Yogurt actually helps keep the pH levels in the vagina balanced. Yes, it helps the normal flora too. Yes. Then, um, many ladies are fond of doing this whenever we visit the loo or we visit the toilet. Most of us ladies are fond of actually wiping from back to front. But what we are here to tell you today is that if you've been doing so, kindly do away with that habit. When you visit the loo, when you want to wipe the area, you don't wipe from back to front. The rationale behind this is that if you wipe from back to front, the bacteria from the anus is actually introduced into the vagina. It will be introduced into the vulva area, thereby entering the vagina to cause infections. So when you visit the loo or you visit the toilet, please, you wipe from front to back and not from back to front. Please and please, you wipe from front to back and not back to front. Also, the next on the list is getting tested. If you have regular checkups, it helps you to do away with BV. But if you are a person who doesn't really go for regular checkups, and you feel like you have this fishy smell, or smell that is not pleasant, you quickly get to the hospital and get tested. Yes, and then you do checkups regularly. Yes, so you can do away with BV. Also, you follow treatment regimen. When you come to the healthcare sector, healthcare department, and we help you, you try to follow and comply with whatever we tell you. By so doing, even if you have it, you will be free from it. You do away with it in no time. You just have to comply with treatment regimen. Also, try and stay hydrated. You know, hydration actually helps the body to flush out harmful bacteria. So you try to stay hydrated by drinking a lot of water in order that you flush out any harmful bacteria from the system. Then lastly, you can consider pH balanced products. If you must use anything under there, if you must consider any product, then they should be pH balanced ones. So you consider pH balanced products to help keep the um, vaginal flora and the pH level there intact. You can take probiotics. An example of probiotics I talked about is yogurt, and other you have other ones too. So you can stick to taking probiotics in order to help balance the pH levels in the vagina. I hope you are enjoying this session. Please don't forget to like, share the video, and also subscribe if you've not done so. Please hit on the notification bell to stay updated. I would also like to take us through nursing management when it comes to BV. The management we give to our clients, we nurses, what we do for our patients and clients when they visit us. How we manage to clear their anxieties, how we manage to reassure them, to allay all anxieties and stay okay without feeling embarrassed. So, if a client comes to the hospital, if a client comes to the hospital and manages to tell us about BV, I'm using this statement because most of us shy talking about them, and it's not everyone that is encouraged. It's not everyone that gets the zeal, is able to come to the hospital and talk about it. So if a client manages to come and share it with us, what we do at first is that we take the medical history of the client to include previous BV if the person has had the condition before. We also take history for any other STIs or any other gynecological problems the person has. We also do symptom evaluation for the client. That is, we check for discharge, itching, odor, burning, sensation, and all other symptoms that comes into mind when a person has bacterial vaginosis or vaginal odor. So yes, secondly, we do symptom evaluation. And by so doing, we check for discharge, odor, and itching, all those symptoms. Yes. We also do physical assessment. We do physical assessment to include pelvic exam, yes, and discharge assessment as well. We check on the pelvis, then we also do our assessment on the discharge the person is having. Then, as per the doctor's advice, we direct the person to the laboratory to do certain tests. Some of the tests they do, some of the names of the tests the doctors let them do is wet mount test, PCR. The full meaning of PCR is polymerase chain reaction test. Yes, and also gram stain test. And whoever is actually found having the BV now comes to us nurses. When they come to us, we try to foster a friendly but not judgmental environment so that they can feel at ease to share everything with us. Yes, we reassure them, we empathize with them to allay their fears and anxieties, and also to discuss the symptoms, the causes, and how to prevent them, the condition with them. Then we administer their medications which were prescribed by the doctor. Yes, we administer their medications, the appropriate medications prescribed by the doctor to them. After giving them their medication, we also offer education on the condition, that is BV. We give them education on how to care for the vaginal area, that is good perineal care. Perineal care refers to the vaginal area and how we care for the area. So we teach them how to care for the vaginal area And also we stress on the need to do away with tight clothing so as to encourage good aeration for the area. So today has been helpful, isn't it? I hope we've all learned something. Don't forget to hit me up in the comment section with your questions. Any other thing I didn't talk about, any suggestion you have, just put them there for me. I'll be glad to answer everything for you. Like this video, share, and if you've not subscribed yet, kindly do so for me. Until then, see you in my next video.